second day of Apollo Hospital's International Health Dialogue 2026 continued in Hyderabad, bringing global policy makers, clinicians and technology leaders together to reshape the next phase of healthcare transformations.
The involvement of the entire healthcare system should be equalized and continuously innovate. The newest innovation, I would say innovation, the newest thing that we're going to announce is going to start the whole world. Everything works. The hotels work, the airlines work, the coffee shops work, all of these work 365 days. Why hospitals don't work on Saturday, Sunday? Are we safe on Saturday, Sunday? I think that this is where Apollo is going to break the big news, announcing we've already prepared. All of our hospitals, all of our clinics, all of our systems will be available for people throughout the year, 365 days, until we brought the first time in the nation emergency, 24/7.
The joint plenary focused on building a collaborative future, with global voices calling for innovation that is ethical, inclusive, and anchored in inpatient safety across borders.
Most important factors in patient safety is that trust that we need to have between not only between internally in the institution, but of course definitely between our people and the institution. And with what's happening these days with moral and information, all the misuse of information, it's getting harder to actually retain that trust and hearing from other people and how they deal with it will be something that we'll take back home.
My experience here is really very positive. We are really happy that we are able to join from South Sudan and learn from the experience, network with people, with other colleagues in the government, ministers or technical staff from over the world, and especially those in India. And our most appeal is we want to have Apollo come to South Sudan. And we are going to be working on that together with the Apollo Hospital Group to make sure that we bring the experience to South Sudan.
Conversations on AI and virtual care examined how emerging technologies are reshaping diagnostics, decision-making, and patient engagement while raising new questions around accountability and ethics.
So AI is a tool. Okay, so the doctor has to own the outcome. There's no question about that. Or the health system has to own the outcome. Now, that's easy to say, but there are other factors. But I do think to that question, being clear about the responsibility and the accountability, and more than that, the desire to understand the improvement in a patient from a doctor's perspective, I think, is important. Even after the treatment has been done, maybe they get transferred to another doctor, but someone like that who's got medical know-how should really work with the patient. Often it's behavior change for the patient, so isn't that black and white an answer? The patient doesn't listen to the doctor, there's so much you can do. I think with AI, it'll help you granularize what a specific patient needs. AI tools can help customize that, but a doctor still has to be involved here because, in the end, people are different, people develop differently, and you can't treat everyone like a robot. They're not.
From Hyderabad, this was News 9.